I'm Justin, by the way, and sorry, this is just an interesting case that I encountered a few days ago of a young woman who had a congenital syndrome, multiple anomalies in her abdomen, and who has had multiple surgeries to address some of these anomalies that she has.
Right cerebellar lesion is stable.
Describe the findings.
Yeah, go for it.
Okay. Okay, so I mean, as you can see, her left kidney is absent congenitally. Obviously, she has a right lower quadrant colostomy.
Does that mean she had anal atresia or something?
Which kind of gets towards the syndrome that she has, which I won't mention it just yet, I suppose. But, and then her uterus, obviously abnormal, so she has a uterine didelphys here.
Missing some bones?
Her rectum,
I'm sorry, what's that?
Is she missing some bones?
Yeah,
yes,
good.
exactly. So there's a partial sacrococcygeal agenesis. And then, as you can see, the bladder is also abnormal. So she has a bladder augmentation with a Mitranoff procedure, appendicovesicostomy. And she's had all these things, and the syndrome that she has is the VACTERL syndrome. And then she also, she presented complaining of heavy menstrual bleeding. And so, we, of course, paid especially close attention to her uterine didelphys. And we noticed, if you look very closely right in here, there's some very mild enhancement. There's some very mild enhancement in her her left fundus in the endometrial canal. There was a suspicion that there might be a neoplasm, like a polyp or something that's in there that's causing all the blood that's in the lumen, and that's causing this enhancement as well.
Or non-communicating.
Okay. And then in addition to, of course, her uterus and cervix being duplicated, she also, it seems like the proximal third of the vagina is also duplicated. And then the right lumen seems to, or the right canal seem to communicate with the right lumen of the vagina, whereas the left lumen over here appears to be stenotic. It does not seem to communicate with that right lumen.
So on exam, they only saw one cervix and one vagina, and so we were wondering if this one was like non-communicating on the left.
Yeah.
Yeah. The remnant uterus.
You're not going to see the left.
No way, yeah.
And so that, and then the uterine anomaly goes along with that solitary kidney.
So the uterine anomaly, the renal anomaly, and of course the surgery, which is secondary to obviously an issue with the bowel, probably an anal atresia.
The T2 hypointense stuff by the right cervix, is that just, what is that? So fibroid or?
The
I think
hypointense
she has a
area?
fibroid,
Yeah, she has a fibroid. She has fibroids, both sides.
Yeah, okay, cool.
Yeah, so we were talking about like if you have a rudimentary horn or a horn that doesn't communicate, and then but it still has proliferating endometrial tissue, that's usually warranted for resection because eventually that can cause like repeated bleeding that isn't getting out, and then dysplasia and carcinoma. So usually if we see the rudimentary horn, we think that it has like blood products in it or any kind of tissue in it, that they would resect that if it's not communicating.
How come we don't see that here? Is it some people get that and some don't?
What do you mean? How come we don't see it?
Like, oh, there it is. Yeah, no, the
Like
rudimentary.
the horn that we thought might not be communicating looks like it probably is filled with like blood and some stuff. And
Yeah.
that's it
Is there
for
anything
us.